Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Well, welcome everyone. I'm Bridget Maloney.
And I'm obstetrician Dr. Patrick Maloney.
And we've just come fresh off a very exciting night where we did a big presentation to a group of GPs.
Yeah. It was about our new collaboration with Monash IVF.
Yeah.
To bring IVF services to our clinic.
Yeah. It was very, very interesting. And actually we covered things like PMOS. We covered fertility workup, what a fertility consult looks like, the role of endometriosis in fertility,
yep.
And Pat introduced the concept of endometriosis surgery with a robot.
Yeah, I couldn't help.
Yeah,
but
you
put
love
that
it, don't you?
In
Yeah.
there because that's my major professional interest at the moment, and I just thought I'd throw that in there, even though it was Monash's night.
No. Then my favourite thing that you said that night was that when you're doing surgery on with using a robot,
yeah.
It feels like you're a little gynecologist inside just.
That you've been shrunk down and you're inside the patient operating with your real hands. That's kind of what it feels like.
Yeah.
I also got a good laugh about my nun joke.
Oh yeah, that's right.
Yeah.
Tell our audience about why.
Well, I'll tell you quickly. So, our main private hospital here in Ballarat is called St John of God, and it's a church-run hospital, which is, for our international listeners, is common in Australia. A lot of the early private hospitals in Australia were run by the Catholic Church and still are in some way. And our robot is called Sister Joan, and Sister Joan was the last of the St John of God nuns to actually work in the hospital. And there aren't any nuns in the hospital these days. And I just told a gag that when I was in primary school, I wasn't a massive fan of nuns that ran the school, and I just said I would have liked it if someone had told me back then that nuns would eventually be replaced by robots. It got a good laugh.
I'm laughing now, and I've heard it about 3 times.
There you go. So so it was a really good night, really interesting, and a pleasure to bring people up to date on what we're up to.
Yeah, no, it was exciting. So we've got a buzz, about us, and we're going to do a podcast. It's a little bit different from the information-laden podcast that we do, but we see it as a big problem, and that is people being able to discern whether the advice they're seeing on their social media is evidence-based or it's just simply loud.
Or not, yeah.
So, I don't know. I thought it was there's so many examples that we can bring up, but the first one that sprung to mind was remember the United States Health Secretary, J. Kennedy, I think, said that taking Panadol in pregnancy causes autism.
Yeah.
And I think that just shocked every person that had been pregnant or was currently pregnant.
Yes.
Because I don't know what the stats would be, but I would reckon nearly everybody would have taken Panadol.
Oh, 100%.
Yeah.
Yeah. And so that wasn't actually a question up for broad clinical debate. That the fact that Panadol does not cause autism is abundantly clear. It's been proven time and time again. And there is no data suggesting a link there, other than the tired old problem, which we know leads to wrong conclusions, which is that association and causation aren't the same thing. So Panadol doesn't cause autism any more than wearing pants causes autism. And
I'm pretty sure most people have got pants on. So
yeah.
Yeah, it's a bit, that is complex, and we're going to get into, the simplicity that comes across in social media and why that's so easy for people to absorb. It's a very simple message. You can't do a complex message well on social media.
Yeah.
You just can't keep people's attention for that long.
Yep. It doesn't help when the advice leaps over the barrier from social media into the real world and senior people who should know better start saying things that are patently untrue.
Yeah. So the other one I just was shocked to my core with was there was a very big influencer, a woman in her early or late 20s who was pregnant, and she was taking a supplement. And she said, so, you know, I really wanted to find out whether I should be taking this supplement or not. So I went to my OB, it was an American. I went to an OB and she said that, you know, I didn't need to take this supplement. But then, you know, my Instagram feed is full of people saying I should take this supplement because otherwise I'm going to cause like horrible consequences to my child. And then she finished the reel with, so who am I to believe?
Who am I supposed to believe? Yeah. That I remember that, looking at that and thinking this is really the problem, or for that person at least, is really a big one. Because if they think that those are two equally valid and equally accurate sources of information, then who is she supposed to believe? I guess the doctor in me has always thought that the advice that we give to the best of our ability is not just something we made up. It's something based on years of cumulative research and knowledge. And so we have been perhaps coasting along, thinking that the advice that we have been given would outweigh the advice that somebody got off some randos on the socials. But maybe for some people that's not true.
No, this woman was genuinely anxious about it. Like, you know, it wasn't tongue in cheek or satire or anything like that. She was genuinely confused who she should believe. So, you know, and I get it in certain generations as well. It's gone really from my doctor said so, therefore it's true to I'm not sure.
Yeah.
I'm not sure.
Well, there might have once upon a time been too much of the doctor told me to do this, so I'm doing it. And I didn't even stop to think why, which is, you know, that can't be a good thing if we're asking people to put something in their bodies or do something with their bodies or whatever, that should have an evidence base that's beyond there, I told you to do it, now just do it.
Could you imagine actually having that fly in your consultations?
Not anymore. Doctor knows best. I don't think you wouldn't get away with it for long.
No. And nor you should. So, you know, that's what our pregnancy podcast is about. So informing you with the information that's, you know, you can have a conversation with your doctor about, you know, different methods of treatment and plans. Yeah.
At the risk of being overwhelmed by emails, if you think I have said something in the podcast that is inadequately explained, then I think you feel free to get in touch and say, what's your data?
Yeah, you need something more there. But the things on Instagram that I really wanted to point out are the things that say, you know, and you see it, they scream at you, never do this in pregnancy or always do this.
Yeah.
Or, you know, one of our favourite things is these are things your doctor never wants you to know.
Oh, yeah, that's my personal favourite. Let's deal with that one up front.
Yeah.
There is nothing that your doctor doesn't want you to know. Nothing that's true.
Yes.
Of all the true things in the universe, there isn't one of those that your doctor does not wish you to know. So if anything on the socials that mentions that, you can safely ignore up front.
Yep.
That is based 100% in an effort to drive a wedge between you and good advice. And that can't be a great place to start.
The other thing is the doctors don't want you to know, or the big pharma doesn't want you to know, implying that there's kickbacks. And apart from a pen that I have on my desk, we have never received a kickback for anything.
Don't even really get pens anymore.
No, everyone's...
So the kickbacks, like the socials sometimes will tell you that they're literally cash money changes hands. And that has never been part of our medical culture in Australia and is specifically illegal. Even things which was sort of a version of money changing hands, like a company paying for you to go on a holiday or for you to have to go somewhere nice in the sun, and you just had to go to 10 minutes of their conference in the morning, and then you could go to the beach for the rest of the day. That's all gone as well. Yeah. So.
And we're only speaking from an Australian perspective. You know, there might be other countries where that isn't the case, but that is for us.
Yep.
And it is also for doctors selling things such as supplements or whatever. Like in Australia, you can't do that either.
Very tightly controlled. Yeah, very, very tightly controlled.
If you're APRA registered, you just can't do it. So, you know, I know of quite a few very, very famous Instagrammers for menopause who are doctors in other parts of the world, and they can sell whatever they like. So, you know, that is also a bit of a red flag for me.
Yeah. In Australia, it is by, as far as we can tell, when we look at what goes on in other countries, we are extremely tightly controlled. And that's not just with, you know, the selling of things, but even advertising. We can't really advertise.
We can't say that, you know, we're the best, or
you certainly can't say that you're better than anybody else.
Or you could expect better outcomes by coming to see us, or, you know, we no doctor can actually say that. It's restricted.
I remember visiting the US years ago and just seeing a poster. I was on the ferry to go out and look at the Statue of Liberty, and there's a poster on the ferry that says, "I am the best cardiac surgeon."
Oh, I love it.
Yeah. And I just thought, wow, I've never seen anything like that.
Yeah.
So beware things that say that this is a secret that the system doesn't want you to know.
So I want to delve into why does it attract so much conflicting advice?
I think that pregnancy is a time when people can be very easily influenced out of fear. So that the first pregnancy in particular is a scary time for people, and they are often overwhelmed with a sense of responsibility to do the best they possibly can for the outcome of the pregnancy and the safety of themselves, but more in their mind is the safety of the baby. And so that's a population that is relatively easy to exploit with fear-based arguments.
I think also that it's, you know, you're right, it's absolutely high stakes, but it's also the time in a woman's life that she doesn't have tons of control, you know. So it's this juxtaposition where it's high stakes, but there's you know, you can control what you eat and you control the exercise that you can do, but you know, there's lots that you can't control. It's baby behaviour, or it's your genes, or you know, it's something that you've got to accept and roll with the punches a little bit.
Yeah. So if we look at the advice that's given, you know, accurate advice might say careful, subtle, fairly nuanced things that might be different for you as an individual compared to another person as an individual. Whereas if we're going to really try and influence the behaviour of someone by exploiting her lack of control and exploiting her vulnerability to fear-based arguments, then we make broad statements that are inaccurate but go right to the heart of that fear. And that's a lot of what we see on the socials.
The other thing that is common is, you know, there's so many people that have had a baby, you know, so then they have their own experience and their own personal sort of take on things.
Yeah. So that is really interesting, because the medical world looks at something like risk from a community level. You got to zoom out and say such and such an intervention, if it's done, will result in better outcomes per 100,000 women. One extra baby will survive. One extra woman won't get hypertension. But people who've been through a pregnancy before and having another one, that they are mostly focusing on themselves and their own personal risk. And therefore, it's easy to say, well, I did this last time and it worked fine, so that'll work fine again. Now, the person who's thinking that way, they aren't wrong, but they're just not answering the same question as the medical world is answering when we talk about safety.
And that is hard because, especially say in a family or whatever, and your sister might have had one experience. And you want that same experience, but your experience ends up being different. Like, you sort of that's your frame of reference. You're sort of looking within a very small sample size. And the nuance is hard to get across. Like your sister might have done very well with treatment X, Y, Z, but she may be in an entirely different risk category to yourself. Yeah. I want to talk about a little bit about how sometimes really confident posts like seven things you must do to ensure you get a vaginal birth, or really confident posts sound sometimes a bit more convincing than evidence.
Yes. So the first thing I think of when I see those is, if it was that easy, why wouldn't we have done it?
Like a practitioner, why wouldn't we? Yeah.
So that's with my practitioner's hat on. I thought, oh my God, there's only 7 things. Fantastic. I better read this. Because here am I thinking there's hundreds of factors. But if there's only 7, sit down, get a coffee. I'm going to read this. Maybe it comes down to this idea that humans are wired to trust. If somewhere in our prehistoric selves, if the chief of our clan said we're going to go and we're going to up and move to the other side of the plain where there's more food, all right, great, let's do it. So I think we are wired to take on advice and not necessarily think stuff through for ourselves every single time. Our brains are also wired for shortcuts. And so we love confident advice.
We do, yeah. And we like personal stories. Like, who doesn't love a personal story? Like, it's something that, I mean, I don't love listening to birth stories, but it is one of the most popular podcasts. People love listening to personal stories.
Yeah.
But every single personal story is a sample of one. And, going back to your taking a bird's eye view and looking at it from a statistical point of view, like, I've read some of those reports. I've read lots of those sort of research papers, and it's very hard. It's very dense reading. It's very hard to understand the statistics.
Yes. And,
even though I've read lots and I've actually done research as a university subject, but I come back and I say, oh, Pat, did you know that blah, 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 and this amount, and then you help me. I mean, no, that sounds funny, but, you help me understand that more meaningfully. It's really hard to interpret them.
It is. And it's hard. It is hard to, especially for non-medically trained people, to understand what the hell we're talking about some of the time. I think that another problem that's going on in the background is that as human beings, we hate to feel anxious. We hate to feel that we need to make a decision between 2 big options, and we can't think of anything else, and it's really, really upsetting us. So sometimes we'll choose the comfort of a decision having been made over it necessarily being the right decision. Yeah.
And that's why, we talk about a birth plan or a birth map. It's not step 1, step 2, step 3.
Yeah.
It's about sitting with the anxiety around that it's unpredictable, and like you've got to have the knowledge to know if it goes down one particular path, you've got to make decisions.
Yes.
Or if it goes down another particular path, it's another set of decisions. And so, that is so nuanced and complex that you cannot get that small little soundbite on social media.
No, the whole problem with social media is that the message needs to be very brief.
And when I listened to you, and actually from the Monash talk that we just did, and you were saying that you were all excited when the new endometriosis guidelines came out, and then you said, finally I've got something I can go, okay, I can hang my hat on. This is how we're going to do endometriosis.
Yeah.
And yet the guidelines are still like...
Oh, they're disappointing.
Yeah, they're a bit disappointing. They're about like, well, it depends.
It depends. There's a lot of it depends.
Yeah.
Yeah, and there's a lot of, we think it's probably the best thing to do this.
Yes.
And then reference down the bottom, level of evidence, low.
Low, yeah.
Yeah, so that certainly is a problem. Yeah.
And often that's what good medicine looks like, doesn't it?
Yeah.
You know, it's sort of like if you're hoping for a very, very strong definitive this is the answer, lots of medicine can't put its whole claim on that because there hasn't been an RCT.
Yep.
You know, there hasn't got the level of evidence. Yeah.
Yeah. And so, as you said accurately just now, good medicine is nuance.
Which, you know, is the opposite of a very confident, these are 7 mistakes you should never make in your pregnancy, you know, like it's very, very different. Yeah, it's hard to get that message across. All right, well, what about those posts, Pat, that look like they're research driven? They say, the people say, oh, research says.
Yeah.
How can a participator in social media actually work out whether the research that they say that they're referencing is any good?
Yeah, great question. So you can call anything research.
Yeah. My Google, I call that research.
Yes. A distressing number of people call they're looking at social media research.
Yeah.
Yeah. Well, it's not what I mean by research. But that's all right. We can both use the term, but I think people should be roughly aware of what your doctor means by research, and what he or she might be, how he or she might prioritise the confidence that we can have in the conclusion because of the study that's been done. And so, put briefly, big systematic, what are called systematic reviews, are published from time to time by collectives like the Cochrane database. And the point of those is to take a bunch of reliable studies, combine them in a way that is legitimate for research purposes, and add them together to increase the confidence that we can have in their conclusions. So you might put together a series of studies that were done in various countries that were all quite similar. And they issue statements which are among the very best evidence that such and such is true. And there are, the Cochrane, it's not for everybody, but the Cochrane database is free. Get on and have a look. And it's amazing, some of the things that they've looked at. And sometimes they are health issues that you might have thought were relatively trivial actually have a clear, internationally respected Cochrane review on whether or not bananas help with night cramps in pregnant women.
Oh, wow. Do they?
No. Then there's individual randomised control studies, which are thought to be the best trial design, so that if we take 100,000 people and give them one treatment and 100,000 people and give them the other treatment, ideally with none of those people knowing which treatment they've got and none of the people running the study knowing at the time which treatment they've got, observe who does the best and then de-blind the study and have a look and see of the people who did the best which treatment did they have. Those are the ones that we find the most persuasive.
They're very few and far between in the pregnancy world, though, aren't they?
It's hard.
Yeah, it's hard.
Yeah.
Like, could you imagine saying yes when you're pregnant to a trial?
Yep.
That you don't know what it is, you don't know what it's going to affect. I just don't know how they get any of those up.
There are serious ethical problems with doing RCTs, randomised control trials, when you are next to certain of the answer already. And so what you're theoretically doing is exposing half the group in your trial to a treatment that you honestly already believe is inferior. And it's another reason why, not necessarily to open the vaccine discussion, but it's a problem with RCTs being done now for various vaccines that have been thought to be extremely safe and effective for many years. Because how would it be ethical to deny that vaccine to half the group? And so there are similar problems in pregnancy. When we're next to certain that something is already the right way to go. Yeah. And the hierarchy of studies just goes rapidly down from there. Okay, there are sort of observational studies where you just you have someone with a known problem, you give them a known treatment and just watch them and see how it goes. That's not as good as a blinded study. And then right down the bottom is poor old expert opinion, which is just what someone says because they've got a gut feeling.
Oh, I reckon there's another one, and that's the influencer
anecdote.
Yeah.
Yeah.
They pin themselves next to the expert opinion occasionally.
When we look at well-constructed public health messages, often if I don't know if people have seen this, but for example, if they talk about a disease affecting 1% of people, a well-constructed public health message will often have a poster with 100 people on it, and one of the 100 little people, all the rest are red and the other one's green, and it's just these are ways of trying to help educate people. Not what 1% means; people understand that that's 1 in 100, but give a visual message to say that that's rare-ish, but by no means rare.
Yeah, if it was 1 in 100 that your chance of winning Tats Lotto, you would buy a ticket.
Yeah, exactly. So there are a number of known ways to try and help take some of the emotion out of it. And one of the problems with anecdotal evidence from the internet, I did this and I did well, by far the most common that we've seen, I guess, is here's the ticket to a vaginal birth. I did this and I had an easy vaginal birth. And this is complete rubbish. Yeah. You don't hear me make too many. There is no validity in this statement whatsoever. Firstly, if that was a thing, we'd just do it for everybody. All right? Nobody's happier than us when someone has a uncomplicated vaginal birth. Instantly, we should be skeptical of such a claim. But it is not, there's a well-known psychological experiment where if you tell a young child, I can't remember the exact age, but if you tell a young child a story about a boy who goes to the shop and steals a bunch of lollies and halfway home he falls off a bridge into a river and nearly drowns, and the little kid will go, oh, well, cautionary tale. And then you say, what if you went to the shop and didn't steal the lollies? At a certain age of development, the child will say, well, you won't fall off the bridge.
Yeah, right.
But I think when we get to about 4, we stop being fooled by that. And we should be looking at this data and saying there is no connection between what you've proposed and the outcome that you've claimed on the basis of it. We've got to do better than that.
I can't help but think that people who pick up this episode, we're preaching to the converted.
Yeah, maybe.
I don't know how to get it to people that sort of still think that you'll fall off the bridge. All right, so I want to talk about the next thing, which is what should somebody do if the advice about pregnancy comes from 2 different birth experts, but they differ? And the reason why I'm saying this is because recently, and I don't know whether it was, we recently did a podcast on caesarean rates rising, and another really popular podcast got on to her socials and said this. It was her POV. You realise that women are at more risk dying from a caesarean compared to a vaginal birth, and that the caesarean rates are increasing for no good reason, which means more women will die for no good reason.
Yeah.
Now, this went viral. It had thousands and thousands of views.
Who were sucked in by that?
Yep, thousands and thousands of likes, thousands of comments, and I just went, what?
Yeah, because it sounds a little bit true, doesn't it? If you're more likely to die from a section, then the more sections we do, the more people die.
Yeah.
And the only problem is that it's not true. again, the problem here is that association is not causation. And the women in the Caesar group who die, they didn't die because of the Caesar. So caesarean section is actually an extremely safe operation. And the reason why, firstly, we have to be very careful about drawing conclusions from rare outcomes. So very, 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 very few people die as a result of their pregnancy in Australia. Of those that do, there are often people who are so sick for other reasons that their baby is born by caesarean section for reasons related to whatever was wrong with them, not the Caesar itself. Does that make sense? So, for example, in the worst part of the COVID epidemic globally, pre-vaccine, pregnant women were showing a distinct susceptibility to becoming particularly unwell if they got full-blown COVID. And they were coming into hospitals internationally with bilateral pneumonia and circulatory collapse and a complete life-threatening disaster related to having COVID. Now, sometimes when they were admitted to the hospital, their babies would be examined and found to be in big trouble because the woman's lungs weren't working well enough to get oxygen through the baby. So they would say, right, even though this baby's premature, we're going to get out anyway, because if baby stays inside this mum on this occasion, the baby won't survive. Fine, so we'll do a Caesar to get the baby out well. Baby comes out, goes well. Mum succumbs to COVID. Did she die from the Caesar? No, she died from COVID. So that's a good example that association, she had a Caesar and then died, is not causation. She didn't have a Caesar that caused her death. So this argument fails immediately on that basis.
But it sounded very confident, and it was coming from a birth expert.
Yeah, sounded good, but was completely wrong. And the birth expert who made that statement, that this is inexcusable. They should have known that was incorrect. Yeah.
And also, it speaks to everything. It speaks to the fear and anxiety women have in pregnancy. It speaks to people saying that caesareans are on the rise, and they are on the rise. Yep. And if you're interested in really delving into that topic, we've just done a 2-parter. Please listen to that. We talk all about why. And, people like to guilt people for having caesareans.
Yeah.
So, it just spoke to all the emotion that people have around vaginal birth versus caesarean birth. But it's confusing. So how would you advise people to look at information like that?
I think the first thing that we should probably be looking at is a concept of face validity, sometimes in Australia called the pub test. Mm-hmm. Does that sound true on the basis of it? Because I think we can knock some of these things down just because they sound like complete rubbish to start with. And there are certain people in the global political environment that if their lips are moving, just don't worry about it.
Absolutely, yeah.
If we're flicking through the socials, good medical advice, whether it's from a obstetrician, GP obstetrician, midwife, even a quality influencer who was dedicated to accuracy, it doesn't include big, broad statements to grab your immediate interest, like words like always and never. There's no always and there's no never. Things being toxic,
harmful.
These are invariably designed to get your attention or to sell you something. Yeah.
Because, and I hope people hear it from us that good medical advice on the flip side, we're not that, we say on the one hand, in certain populations.
Yeah.
You know, it's not a panacea. Like we don't say this affects everybody.
Yeah. And if someone's looking for a 2-second grab, I can't give a 2-second grab on a complex issue and remain accurate. You might just have to engage in the complexity with me. And I think that's why we made our Grow My Baby program. It's why we made this podcast, because the complexity, it's not boring. It's interesting.
Well, it's obviously not boring because like our podcast has been downloaded 2.5 million times or something.
Isn't that awesome? That is awesome. That is evidence that it's not boring. And why not come along on the ride of the complexity? You don't have to agree with me, but we'll have a better conversation if you are happy with delving into complexity.
All right, everyone. I think the only other point I would make is sometimes you've just got to bypass stuff that isn't relevant to you. Like if somebody's talking about the fact that they had, I don't know, some rare occurrence, or, you know, they're trying to do a different type of birth than you, or I don't know, like, you know, sometimes just protect yourself a little bit.
Yes.
By saying, does this apply to me?
Yeah. So that it's a lot of doctors say don't Google stuff. I don't do that. I think that's inevitable.
Everybody's going to Google.
They will.
We Google.
Yeah. So I try and take a different approach. I'm not sure if it's working yet or not, but I try and take a different approach. I tell people to limit the amount of time, that set themselves clear boundaries to limit the amount of time that they can scroll and worry. So 15 minutes a day of that, and that'll satisfy your need to do it. But I've found personally, I get anxious about things if I give it more time than that. There are other issues. I'm weirdly interested in other things that get me anxious when I read. We
better tell people in case they think they're weird things.
Oh, no, it's not
US
weird
politics,
things.
really.
I'm weirdly interested in US politics, which is something that I have no business being interested
in. And no control. I think
no
you should
control
move on.
over it.
Yeah.
But when I read about the sort of socials, I get this probably skewed idea. That what I'm reading represents the views of ordinary people, which probably only represents the views of people who want to say things loudly on socials. But I know that the key to controlling my anxiety about it is to limit the time. So I try and say that to people. And the other thing I say to people is, don't be embarrassed if you've seen something on the socials or on the internet that you think needs my explanation about why I have recommended something completely different.
Yeah.
Come on in.
Yeah.
Bring it in.
Yeah. Talk to your practitioner about that.
Let's talk about it.
Yeah, exactly.
Yeah.
They should be able to say, well, you know, this is what I'm recommending.
Yeah.
Yeah.
Yeah. Don't just do it.
Yeah.
Come and talk to me.
The additional thing that I do is I've started a separate Instagram account, which is total, I don't know what you call it, like an anonymous one, and I only follow my hobbies.
Nice,
so,
yeah, good. Yeah.
And it's really lovely. It's golf and art.
It doesn't angry up your blood?
It doesn't angry up my blood.
Yeah.
And I also still limit myself on that because even now it's worked out how old I am, where I live.
Yeah.
Like, so now I'm getting all these menopause things and I'm like, oh, go away. This is supposed to be my happy place.
So what's on there? Art and golf?
Art and golf, yeah, and some gym stuff. So, you know, maybe that's another thing. If you're feeling like your pregnancy-laden social media is getting you down, sick of seeing the influencers and all the wacky things they're doing with their pregnancies, have a different account that you flip into and just feel at peace.
That sounds like very good advice. I'm going to take that advice.
Good. You do that, Pat. I'm sick of you being on my Instagram account and skewing it with all your US politics.
It's probably, yeah.
Good. All right. Well, I enjoyed talking about that because, you know, Pat and I talk about this all the time. We sort of have this fascination and we find things on the internet and we go, oh, my God, Pat, did you see this? And sometimes I can't actually show you because you get too angry.
Yeah.
So I know I sort of have to pick my moment and go, oh, what do you think about this, Pat? And he goes, ah. Good. Tell us how you go. What are you doing to help you discern your good information? Just come into our Instagram, DM us, we'll have some posts up about this so we can start the conversation, because I think it's a really vital one, and it's a vital one for everybody's psychological health. So you can grow your babies in with some calm and some confidence and a bit of peace. If you enjoy our podcast, we would really like to ask you to do two things. One is share it with a friend, and the second is to give us a 5-star review on Spotify or Apple or wherever you listen to us. That really helps to push our podcast out to other people. And if you're loving our evidence-based information, sign up to our free newsletter. You get a week-by-week newsletter telling you what happens at each stage, each week of your pregnancy. All right, until next week, keep well, keep growing those babies, and we'll see you next week.
Thanks for listening, everybody.
Bye for now. Hey, even though Dr. Pat is, well, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.